Welcome to this introductory module on person-centered language for individuals who work in acute care settings. This presentation will take 10 minutes to complete. In this module, we will do the following. 1. Define person-centered language. 2. Acknowledge the impact of person-centered language in acute care settings. Desmond Tutu once said, "Language is very powerful. Language does not just describe reality. Language creates the reality it describes." In this module, we will be talking about the use of person-centered language when documenting responsive behaviors in older adults. So, what is person-centered language? Person-centered language is language that is specific, objective, and respectful. Let's begin by learning more about this definition. Person-centered language is specific. This means writing a brief description with precise details on the who, what, where, and when something has happened. Using specific language allows other team members to easily understand what you are describing, with less room for misinterpretation. Specific language enhances our ability to plan and evaluate patient care. It enables the team to implement interventions and evaluate their effectiveness through the use of clear details that are not open to misinterpretation. Let's look at an example. Read the vague sentence in the left column. What do you think is happening with this patient? Agitated and upset are vague words that can mean different things to people. How would you know if the agitation was getting better or worse? Now look at the specific language example on the right. With this example, it is easier to determine if and when the person becomes agitated and if it is getting worse. We know what specific behavior to look out for. We can accurately monitor the impact of our interventions on the patient behavior. The key point here is to clearly describe the behavior using specific details. Person-centered language is objective. It has been said that words cannot change reality, but they can change how people perceive reality. When we use objective language to describe our assessment findings, we use observable or verifiable facts and not personal opinions. What we write will influence the next clinician who interacts with this patient. The words used in a patient's chart can follow them throughout their stay in hospital and can influence the discharge planning process and access to long-term care. Let's look at these examples. In the left column, we see a behavior as being labeled as sexually inappropriate. As we discussed previously, a vague term such as sexually inappropriate might mean different things to different people. In addition, the word inappropriate is the judgment of the writer and negatively labels the patient. It suggests that the patient is doing something that is wrong, offensive, or undesirable. We know that persons with dementia may not be able to communicate their needs using words and that their behavior may be a signal of an unmet need. For example, perhaps this person was too hot, or was feeling restricted in their movements, or the fabric was uncomfortable against their skin. Now read the statement in the right column. Objective language will help you and others look past the behavior to seek an understanding of what is happening. When you document objectively, you are better able to plan care, monitor your interventions, and minimize bias. Person-centered language is respectful. This means using language that avoids labeling or infantilizing the patient. The language we use can promote, empower, and increase self-esteem, or it can demean, devalue, and disrespect those it refers to. Through our language, we can demonstrate a recognition of identity, personhood, and respect. Using specific, objective, and respectful words when we communicate with older adults means our conversations don't condescend or infantilize. There are consequences to using labels. Labels can create expectations, stigmatize, and impact care decisions. Take a minute to read these examples. In the left column, we are labeling this patient as aggressive and not providing specific and objective context. In the right column, we are describing what happened in a specific and objective way. We avoid attaching a label, provide a clear description, and help guide our team to seek a better understanding of the behavior. For example, is the person in pain? Do they feel off balance? Or are they frightened when we try to stand them? Have you ever heard care providers use the terms aggressive, difficult, and challenging when they encounter a person presenting with the symptoms of disturbed perception, thought content, or mood? The language we use to describe responsive behaviors of dementia, delirium, or mental health conditions is impactful. Although our intentions may be good, when we use non-person-centered language, we perpetuate stereotypes. We stigmatize, dehumanize, label, and infantilize patients. Take a moment to reflect on the phrases on the screen. Let's take a journey into acute care to see the impact that language can have on patients. We begin with an older gentleman living happily at home. An unexpected fall leads to the call of 911 and transport to an emergency department. His questions and comments to the paramedics include, "Where are you taking me? Who are you? Don't touch me," and "Leave me alone." The words confused and resistant to care are used when report is given to the team in the ED, setting the stage for the team to interpret his words and actions in a negative manner. His questions and comments are seen as signs of resistance. When he pulls away from having blood work drawn or declines to take oral medications, he is labeled as difficult. During his admission to hospital, physical restraints are applied. Clear understanding of the meaning of his words and actions is not sought. He is described as non-compliant, aggressive, and challenging. His physical activity is impacted by these labels because he is left in bed much of the time due to his care team being fearful of a physically responsive behavior. He loses strength and function. Eventually, he is ready to be discharged from hospital, but he isn't going back to his home. He is now going to a long-term care home. Not using specific, objective, and respectful language was detrimental to this patient and his care team. He was labeled and stigmatized. His care suffered because the meaning of his behaviors and his care needs were poorly understood. When we use person-centered language, we enhance our ability to plan care and demonstrate respect for patients. The words we use can influence the care team and what is documented, and they can also influence how patients and families feel during their hospital stay. This quote from Maya Angelou reminds us that words create an emotional response that can stay with patients and families long after they leave our care. As this caregiver notes, the use of infantilizing words and tone of voice revealed that the care team was not seeing the person, only the diagnosis of dementia. Take a moment to read these two quotes. This e-module was developed by the Regional Geriatric Program of Toronto, with support from Behavioral Supports Ontario, BSO, Provincial Coordinating Office. It builds on the e-course Person-Centered Language, an overview for long-term care team members, which was co-developed by BSO and the Ontario Centres for Learning, Research and Innovation in Long-Term Care, CLRI, at the Research Institute on Aging, RIA, in collaboration with MacHealth at McMaster University and supported by an expert panel.